Hi, this is Dr. Supreeth, working as consultant medical oncologist at Sri Shankara Cancer Hospital and Research Center, Paswangudi, Bengaluru. Another popular myth that we want to bust today is does consumption of carbohydrates as such increase the risk of cancer or increase the risk of cancer progression when a patient is on treatment for cancer. This is again completely not true, doesn't have any evidence backing it. The idea behind or the hypothesis behind this is that cancer cells are dependent on glucose for their growth, and carbohydrate rich food is also rich in glucose. So once the body becomes available of excess carbohydrates, this carbohydrates or glucose is used by the cancer cells, and thereby they grow more as compared to those who consume less or no carbohydrates. But again, this is available so far, doesn't suggest the same. The consumption of wheatgrass or Ayurvedic products like giloy juice, aloe vera juice, would that reduce the risk of cancer as such or reduce the risk of cancer progression? This is another question asked by the relatives or patients themselves. So there is no scientific evidence to back either of these, whether restricting carbohydrates would reduce the risk of cancer or increased consumption of diet like wheatgrass, giloy or certain Ayurvedic products or even millets as a matter of fact would reduce the risk of cancer or cancer progression. In fact, these myths unnecessarily would deprive the patient of appropriate nutrition that is required, which is very important when the patient is on chemotherapy. For example, if a patient likes certain type of diet, if the patient likes rice, and if you deprive the patient of rice in the name of low carbohydrate diet, obviously the patient will not be interested in consuming anything else, and this would drastically reduce the patient's weight and thereby the tolerance to chemotherapy. So we should not be encouraging these counterproductive measures in the name of our myths and cause trouble to the patient when the patient is already going through a lot of trouble while taking the treatment.